Good afternoon and welcome to TMC Fertility's Instagram Live event for this week. I am Dr. K.R. Chong. I'm a consultant gynecologist and a fertility specialist. Joining us today is Ms. Shazeema.
Hi everybody, my name is Shazeema. I'm a clinical psychologist at Thomsom Hospital, Kota, Damansara, and also at We Care Lighthouse Center.
Yeah. Okay, good to have you aboard.
Thank you.
So as you all know, today's topic is on preparing your body and mind for IVF. So for the past 24 hours, we have sent out a request for you guys to send in all your questions, and we will try to answer all of them within the next 30 minutes or so. Okay, all right, so let's start now. Okay, the first question we have is how to de-stress when your work is very taxing. This looks like a question for you.
All right, so thank you. So how do we de-stress when work is very taxing? So I always believe that everybody has their own coping strategies. So they always have some kind of go-to activity or something they do to actually de-stress themselves. And it depends by that person and according to what they are comfortable with. So I would suggest to everyone who's listening, if your work is very stressful, always have at least 10 minutes or 5 to 10 minutes where you actually set some time for yourself to either do that particular activity that would make you feel better about yourself or will distress you. For example, you could meditate. Some people like to meditate. Some would go for a quick, maybe a quick jog, or they would actually call someone or talk to someone. Talking to someone would actually really help in stressful situations. Some people also go to watching motivational videos, or in general, some people will just sit down and just take a break where they'll have a snack and some tea, and they actually really take that particular time to actually de-stress. So I hope that you do have your own way of actually de-stressing yourself, and you will try to accommodate that to your working, your schedules. Yeah.
Okay, that's a very sensible topic. Now, a lot of questions I do get from my patients is they are working mothers. All of them are working mothers. So when they come and visit me in the clinics, it mostly is a work day. So they have to go through traffic jams and they have to take time off from work. So that's the tricky part. So sometimes their bosses are not very understanding, or they're keeping their treatment secret from the family, from the friends, so they don't have any shoulder to turn on. I mean, what's your advice for this?
Okay, so once again, I'll go back to what they are comfortable with. If you have a very stressful life at that time where you're working and then you have to go to the clinics and everything, it is about really being mindful about what is it you do during the day. So even if it's 5 to 10 minutes, if you actually sit down and take some time to actually take it for yourself and to start maybe meditating or actually just sitting down and to actually assess what's going on in your life at that point and to calm yourself down, it would really help. So that practice is to have like 5 to 10 minutes every day to actually give some time for you to process what's going on, because our day-to-day lives are very busy, especially for working moms, and those they don't have anyone to talk to, or when they're hiding those type of things from people, so they may not be able to actually talk to people who actually understand what's going on. So in that case also, I would probably tell them maybe what they could do is also join like a support group for others who are actually going through the same treatments, so that they can actually share what their concerns are about.
Okay, all right. Very, I agree completely. Yeah. Okay, now looks like we have a few new joiners. So for those who have joined us, welcome. Yeah. So this is our Q&A session, and we are going on to our next question. So number 2, is there any food that I should avoid before getting IVF treatment? Okay, this is a very common question. Okay, Malaysians, we love our food. Okay, we love eating. We are obsessed by food. We're surrounded by food everywhere. So the simple way of answering is you eat now as if you're already pregnant. Okay, so that makes it very sensible. So if you're pregnant, then of course you'll be avoiding things like alcohol, you won't be smoking, you won't be using recreational drugs. Okay, all the rest, you just eat sensibly. Okay, eat the main food groups, take a lot of vegetables, fruits, proteins, either from animal sources or from vegetable source, if you're vegetarian. Carbohydrate, okay, this is a very tricky issue. Make sure you take a non-processed carbohydrate, okay, not too much of carbohydrate because that has a lot of sugar content. Vitamin-wise, you can take any prenatal vitamins. They already have enough folic acid, iron inside them already. Okay, so some things they usually ask is, can I take coffee or drink coffee?
Yes.
And this is a common thing because we love our coffee as well. So there are studies in overseas saying that excessive coffee, excessive means more than 200 milligrams of caffeine, okay, that's like 4 cups of coffee a day, may cause miscarriage. But you're only taking 1 or 2 cups, coffee, tea, for me personally, it's all right. Spicy food is another thing a lot of people ask. Well, spicy food is okay. For me, it's okay. Yeah, because if you take very bland or you tell yourself, I'm going to give up coffee for 1 year, I think that's very depressing. Yeah? So people going through IVF already depressed, and if I tell you no more coffee for a year, then I think you'll plunge into serious depression.
Totally agree with that. Yes.
Okay, so the third question, would stress affect my chances? I think we've sort of gone through that a bit already. Would you like to?
Yeah, let me just give a short answer to that. Okay, so generally, what is stress? Stress is your body's way of responding to any kind of demand or threat. Okay, so generally, that would mean that yes, it is somewhat it could be in a positive manner and it could be a negative manner. But if it is prolonged, then it would get detrimental to any well-being, your general well-being, not just the fertility or anything like that, but in your general well-being. So links between studies show that women's levels of day-to-day stress has lowered chances of pregnancy. And basically what they say is that generally your body is kind of smart. It knows when it's not good times to have a baby. So if you are stressed, yeah, possibly it would affect your chances.
Yeah, completely true. Completely true. The stress hormones, when it's elevated, your body thinks you're undergoing some war or famine, and it will shut down non-essential things, like getting pregnant. So people under stress sometimes their cycles just shut down because the body is not ready for pregnancy.
Yeah,
okay,
that's right.
The fourth question: what are your thoughts on CoQ10 enzyme and Ovasitol for IVF for people with PCOS? So, okay, this is a bit more specific. So PCOS is a condition for those who've just joined us. PCOS is polycystic ovarian syndrome. It is a condition whereby ladies have a good number of eggs, but their eggs are not working very well. So this leads to very irregular cycles where their cycles are always delayed. They have excessive hormone growth. They have pimples, weight gain, hair everywhere. They're not supposed to grow. And there's also a metabolism problem, which is their high insulin as well as high sugar levels. So CoQ10 and Ovasitol, it's a brand name for inositol, are some of the supplements we take. They are recommended in theory to help control the sugar levels. So yes, of course, you can try. But the key thing to remember for PCOS ladies is, number one, you have to maintain your ideal weight first. Okay, if you're overweight, your BMI is more than 30, try and bring it down as close to the normal as possible. Normal is 18 to 25. The second thing is your sugar are out of control. You need to control that as well. So any method to bring those down, that's important. Okay, so the next question. I have been taking metformin for 5 years. Should I check my B12 before IVF? Okay, so metformin is a medication we give to early diabetics or ladies with PCOS and they have high sugar problems. So the key thing about diabetics is you want to make sure the sugars are really low. Okay, if the sugars are not well controlled when you get pregnant, with or without IVF, studies definitely show increased risk of miscarriages, fetal anomalies. They get things like hole in the heart, they get cleft palate, brain abnormalities. and and the baby may just suddenly pass away inside the tummy. So that is actually the most important. Levels like B12, I don't usually measure B12 levels because B12 is a very common supplement you can get from eating food, animal products, or even the multivitamins. You also already have B12 inside. So just stick to those. That's enough. Okay, question number 6. Is bulimia detrimental to fertility?
All right. So let me just explain to you what bulimia is. So bulimia nervosa is like an eating disorder. So what happens is a person would end up eating large amounts of foods with a loss of control over it. And after that, what they do is that they will try to get rid of it by either vomiting or, they'll get rid of the calories by vomiting, or they either take laxatives to get rid of whatever they have consumed. So they are very aware of their body and how much they put in their body image. So perhaps this would probably lead to menstrual cycles which will go haywire because their intake of their nutrition and whatever is going on is not very good. But I think Dr. Chong can answer this question even better than me, so I'm passing it over to you.
Okay, bulimia. I think the most famous sufferer of bulimia is Princess Diana. Okay, I remember when I was, in my medical school days, when she was still alive, she had problems with bulimia. So I think a lot of us knew about bulimia from there. So bulimic patients, they are usually undernourished, very, very undernourished. Their weight is also very, very low. Their BMI could be 15, they weigh maybe 30 kilos. They don't have any menstrual cycles because the eggs are shut down. So the treatment medically for them is to get them to start eating again, eating sensibly, either under the guidance of a dietitian and also a physician, and definitely a psychologist.
Yes, that's right.
Yeah. So I suppose it's important to tackle what is causing the bulimia.
So yes, I think for this question, that would mean that they would have to go through like sessions with the clinical psychologist, dietitian, and physician before they even can go for treatment, I would suppose, because they need to get that part fixed first.
Okay, now the next question. Okay, my husband is having low sperm count. Can you advise how to boost our fertility at this period? Okay, low sperm counts is very common. Out of 10 couples who come in to try and get pregnant, 4 of them, the male partner has some abnormal sperms. Yeah? So low sperm count, or very slow swimmers, or just basically abnormal shaped ones. So what is this due to? We believe it's due to lifestyle causes as well as environmental effects like toxins and all that. So the first thing you can do, number one is if your husband is smoking, make sure he stops. Okay. Number two, if he has a medical disorder like diabetes or high blood pressure, make sure he gets it sorted out first. Okay. So high sugar levels not only affects women, it affects men as well, especially the sperms. Now, supplements wise, there are a lot of things that you can take. You can take Q10, vitamin D, selenium. Okay, all this can help increase the sperm counts. Even herbs, like fenugreek. There's so many things you can take. The key thing is once you start treatment for sperm, you need to keep at it for at least 60 to 80 days. Okay, you can't take 2 weeks and expect a miraculous change. The sperms need about 60 to 80 days for a new growth cycle. Okay, the next one is also a fertility question. What is your take on taking L-arginine prior to IVF? There's another close question. What would be your maximum allowed dose for CoQ10, vitamin D for someone who has failed? Okay, my general advice on taking supplements is this. Okay, supplements, they work best if the body has some deficiency in the first place. Okay, if the body already has enough nutrition, adding extra dose or super high dose will not do anything further. So vitamin D deficiency is very common among ladies and men. Okay, so we definitely want to add that on. CoQ10 works as well. Okay, but if you are already on good doses of Q10, pushing it further will not do anything, right? So supplements will only restore the body's level back to the normal level. It cannot push it way up high. Okay, for example, you're driving on the road, you get sleepy and you start wandering off the road. Okay, so now new cars, they have automatic systems to push you back. So supplements is just like that. They keep you back to the normal levels. Okay, there's no way when you take supplements, suddenly your car starts flying and you reach home faster in 2 seconds or something. It doesn't work that way. So supplements only help restore to normal. So it's kind of misleading when we see a lot of articles saying that, you take this fertility diet, you boost your chances. You take this supplement, Y, X, Y, Z, then your thing will get boosted. Okay, there's no such thing. It only restores it back to the normal potential level that you have. Yeah. Okay. The rest of them is probably just a lot of marketing. Okay, how much time do I need to put aside for an IVF cycle? And how much time do I need after rest for embryo transfer? Okay, this is probably more on my side. Now, an average IVF cycle now, the actual IVF cycle takes about 2 weeks, right? So from start until the day 14 of it, you need about 14 days of injections. But preliminary, you need 1 month ahead to look at a doctor for him to do some scans, blood tests, review the results. On the IVF cycle itself, you need everyday injections. Okay. After we take down eggs and we pack the baby, we need another rest as well. So make sure you take plan at least 3 to 4 hours when you want to visit your clinic. Okay, because you have traffic jam, you have to wait for the doctor, especially if your doctor is a very busy, popular doctor. You have to wait for the medication. You have to wait for the nurses to teach you how to administer injections. So it will be very likely over the weekday. So you need to have a way of letting your colleagues know and keep them able to cover you when you're going on these visits. For daily injections during IVF, you need to wake up about 30 minutes earlier. Let's say you wake up at 7 in the morning, you need to wake up at 6:30 because you need extra time to give yourself the injection. So you can either go to a center for injections, but then you waste a lot of time. So you need to wake up a bit earlier. After transferring the embryos, we recommend that you rest for about 2 weeks. So you need to think about how you're going to approach your boss. It's either annual leave or you have to get creative and think of an excuse. We can help you write letters, we can help you give MCs. That is not a problem. But over on your side, you need to think about the repercussions. So a lot of my patients who are working, they usually push the IVF cycles in December. So December is a very popular time for IVF in our centers. So IVF doctors, they do not go on holidays in December because they're maxed up. Yeah. So other things, so sometimes they schedule it over school holidays. That's also a very popular time. And of course, if you're an accountant, okay, they will only do it after closing of business year, after May or June. Yeah, so those are the things you need to think about. I get anxiety attacks sometimes, especially now since I'm at home a lot. Are there any simple techniques you can recommend for me to calm down?
All right. So for anyone who has anxiety attacks at home and you want some tips on how to calm down, there are a few techniques. But once again, I would like to say this I usually tell this to most people, that if you think that it is quite severe, it is best that you do go and see a mental health practitioner rather than just staying at home and trying to figure it out by yourself, because of course there are a lot more of techniques that the mental health practitioner will be able to teach you once face to face. But keeping that in mind, I will be sharing some of the tips to do at home. So these are some things that you probably can go online, you can watch some videos and see how you actually can use it for yourself when you're having anxiety attacks. So there are some techniques such as deep breathing. You can note this down and check it out later. So it is a technique to practice relaxation. Meditation could also help, and mindfulness techniques. Mindfulness is like a technique that would make you feel what the present is and fully engage in whatever you're doing at that current moment. So it will free you from distractions, it will free you from judgments, from thoughts, from feelings, and it will make you feel like as if you are there only at that time, and you will focus on the things that you will do. So that would take your mind off from whatever that is causing you some anxiety at that moment. So it's a very, very useful technique. And I think that anyone who's listening to this IG Live today, you should try to go and practice that. Look up online and try to look for videos that would teach you on how to do mindfulness techniques. Another thing that I would say is that maybe you need to, first thing about anxiety attacks is that you do know that if you do get an anxiety attack, the first step is to recognize that you are having an anxiety attack. So once you actually acknowledge that you have that anxiety attack, then you would be like, okay, so you consciously think, okay, this is an anxiety attack. So what do I need to do next? The thing about anxieties are, or when you have worries, the best thing to do is to prepare yourself for it so that the blow of it, or basically you can prepare for getting better as soon as possible. So you will know the technique. So you will know like, okay, I need to do this when I have an anxiety attack. So the first step is to recognize that you have an anxiety attack. Yeah. So back to what I said earlier on, if you don't think that you are able to do this by yourself, it's best that you come and see a mental health practitioner, come see a clinical psychologist or a psychiatrist or a counselor that could help you out. All right, because of course there are normal levels of anxiety and there are abnormal levels of anxiety, and those are the things that you need to take into account. So let's say I will let you know how you know that it is a normal level of anxiety is when the thing passes on and it doesn't affect you as much, but let's say the anxiety goes on that it actually affects your normal daily functioning. So that means it stops you from doing something normal, like that normally that you would do. For example, you wanted to talk to a colleague and the anxiety is stopping you from talking to a colleague. Then that is abnormal already, abnormal levels of it. That means every time you want to talk to someone, you have anxiety, you have an anxiety attack. So those are things that will stop you from doing something normal in your daily functioning. So that is how you actually know then that you need to go get help from a mental health practitioner. All right.
Okay, very important concept there. Okay, I think we have just some time for one last question. Okay, it's also a psychology related one. Are mental illnesses hereditary? I want to have a child, but I want to understand my own hereditary risks.
I see. Okay, so the first thing I would say is that there is no known cause for mental health problems or mental illnesses. So we cannot pinpoint and say yes, it is a hereditary factor, and that is what is made me have depression or anxiety or something like that. That is the main cause. No, it is a risk factor, but it's not the cause totally that a person, if my father has anxiety, then I'm going to get it as well. No, there's no such thing, there's no link. So it is just a risk factor. So it's just one of the factors that may lead you to have anxiety, depression, or any mental health problems. So I think I would say that you don't really have to worry about it. Of course, don't worry about it that it's something totally linked. No, it is just a risk factor. I hope that answers the question.
Okay, right. So I think that's all the time we have. To all the audience who joined us, thank you for coming in and sharing your half an hour with us. Ms. Shazeema, thank you for co-chairing this talk with me.
Okay, thank you, Dr. Chong. Thank you.
Okay. So thank you everybody for joining. Goodbye.